This is one of the patients brought to Uganda Cancer Institute for treatment this morning. Due to her weak state, she had to be carried into the institute's emergency ward. In the ward, she could only be catered for by the in-charge, Jovian Nableje.
I am working on triage, I'm receiving administration work, I'm also working on inpatients. I have to sort out everything.
At the pediatrics ward of the institute, in-charge Susan Nabakoza has also found herself in similar circumstances. The absence of health workers has left her with a skeleton staff to work with.
It is a unit that requires a lot of services. We handle a patient as an individual. Every patient has a lot to be worked on. And being one nurse, I cannot do everything a patient requires.
We tasked both in-charges to explain why their staff was missing.
They're telling me that they're unable to come because they have no transport. That's the reason they're giving me. And all of them were supposed to work, they have not come.
I don't want to say it is a strike because some of us don't know that there is a strike. There is, although we are hearing rumors that there could be people don't want to come.
This has been blamed on the institute's failure to pay their December salaries. The health workers mainly affected are those already employed on the government payroll, since their counterparts who are contractual workers with the institute have already received their salaries.
Yes, it's true, we've not been paid, but administration is handling it around. However, you cannot, I cannot say no. I cannot say please come, please come.
The communication is not official to us. That's why we have no bold information to tell the subordinates to come and work.
This sit-down strike has affected the delivery of health services to cancer patients who turn up at the institute every day. When asked on this matter, Dr. Jackson Orem, the executive director of the Uganda Cancer Institute, declined to speak to NTV on camera. However, he admitted that the salaries were delayed but eventually paid, thus dismissing claims that some members of staff did not receive their money. Ministry of Finance spokesperson Jim Mugunga has also confirmed that funds to cater for the workers' salaries were released and the shortfall is therefore on the institute side.
Now, where we have situations where some employees, as we've claimed in this particular incident, may not have received their money, that could be a localized problem arising out of failure to onboard employees following the right procedures or failure to budget for them.
The affected health workers have sworn to stay away from work until they receive their salaries. Joyce Nakato, NTV Tonight.